Hi everyone, my name is Salia Farrokh and I'm excited to revisit Lean for a project that I'm working on in 2025. This is our meeting agenda for today. This project that I'm leading is designed to develop a strategic plan in collaboration with hospital formulary team and pharmacy chief of operations to shift inhaler treatment to nebulizers into hospital units from May 2025 to December 2025, and to reduce meter dose inhaler or MDI waste by 90% during this time. These changes will result in better waste management, cost savings, and reduce environmental pollution. The objectives of my project include to minimize pharmaceutical waste, reduce environmental pollution, and improve cost savings. As we know, core principles of Lean include process improvement by elimination of waste and promotion of rapid balance flows. This picture nicely illustrates the 8 wastes and insufficiencies commonly encountered in hospital pharmacy operations per Lean manufacturing principles. For my project, I will focus on the inventory waste, but I wanted to point out that according to Lean, service time and human potential are also valuable resources and should not be wasted. To provide some background about this project that I'm leading in 2025, meter dose inhaler or MDI is a very common medication delivery system for some chronic respiratory issues such as asthma, and MDI relies on an ingredient called HFA or hydrofluoroalkane that helps to eject the medication into the lungs. In 2020 alone, leakage of HFA was associated with a lot of CO2 production, which can lead to global warming, and transitioning away from HFA and basically MDIs is necessary to step towards decarbonizing the US health system. In addition to MDIs, there are other medications that can be reviewed. Commonly used medications such as Advil, which is a painkiller, can negatively impact the ecosystem, but for the sake of my project, I will focus on the MDIs. To review the principles of Lean, it's important to review the House of Toyota that was initially developed in the 1950s in Japan. House of Toyota is a complex mix of philosophy and best practices. I would like to focus on stability, which is the foundation of this system, and then Kaizen, which reviews incremental, small, continuous changes, and it involves everyone. Obviously, standardized work is important and is included in the system to ensure consistency and reduce variation. And then Hayuka, which is looking at workload leveling of business processes. In the pillars, we have just in time to minimize delays. And then Jaduka, which is minimizing defects and providing high quality care and services. And ultimately, the goal is to provide the highest quality, lowest cost, and shortest lead time. Now back to my project. In the US, 88% of all inhalers are considered to be MDIs. Alternative delivery mechanisms such as nebulizers can be associated with a much lower production of carbon dioxide. Studies show that 87% of MDIs dispensed in the hospitals are wasted at an estimate cost of about $87,000. One study specifically showed that there was a net annual cost saving of about $31,000 by transitioning to nebulizers. This waste is coming from the fact that these inhalers contain 30 days worth of medication compared to average hospitalization length of 5 days. So these patients get the inhaler and it's intended to be used for 30 days, but then they leave the hospital after 5 days. For this project, I would like to use the PDSA cycle of Lean. The problem is the high CO2 production with the MDIs, and the plan is to provide education to staff about this transition and to change our formulary from the MDIs to nebulizers. My goal is to implement this project in one inpatient hospital unit first and start my data collection after a month on waste minimization and also adoption by stakeholders on this project. Then I will analyze all the data that was collected to understand our process better. Ultimately, I would like to expand this project and this change to another unit during the time frame that we talked about, and to understand barriers and make adjustments along the way as necessary. This project will lead to reduce waste and improve cost savings. There are some weaknesses because we need to get this accepted by different stakeholders. This route of administration also will require longer administration time, and we may need to hire more respiratory therapists, which means initially we need to invest in this project to be able to save the money. The opportunity is to talk to FDA and get some regulatory bodies involved for considering environmental factors during the drug approval process. And then obviously drug shortages will always be a threat, because if nebulizers go on shortage, then this process will be slowed down or even stopped. So in conclusion, the MDI inventory should be changed to nebulizers in 2 hospital units during the time frame that we talked about. This will result in a 90% reduction in MDI waste, and the remaining 10% accounts for medications that are simply not available in nebulized form. These operational changes will result in better environmental outcomes and cost savings. Thank you so much for your time, and I'm looking forward to your feedback.